Hi, I'm Donna Dowell, board certified family nurse practitioner and part of a growing number of healthcare professionals in New Mexico in support of the New Mexico Health Security Plan, a plan that will ensure comprehensive, quality healthcare coverage for all New Mexicans. Healthcare under our current system is challenging for many. This short video is part of a series that features the personal healthcare stories of real New Mexicans, many of which you will recognize as all too common.
Hello, my name is Kathy Wooten. My husband and I live in Las Cruces. My story of medicine and shocks in New Mexico goes back to 2014 when my husband's small company struggled but did provide healthcare insurance for us. That was never going to be a sure thing because of the changes every single year. But at this point, we did have the insurance. My husband was waiting to be seen by a physical therapist and fainted before he could be seen. Nobody understood why, most of all us. I wasn't present, and they transported him to the ER at Memorial Medical Center by ambulance. He was in the ER for about 3 hours, being evaluated and seen and attended to in a very good manner. There wasn't much information that came out from that 3 hours, but the ER doctor felt that it would be better for him to be monitored and observed overnight in the hospital. When we left the emergency room, we thought we were being admitted to the hospital. Well, we were wrong about that. We went to the third or fourth floor. My husband had more exams of one kind and another. The hospitalist came in and observed him and interviewed him. And the next day we were released, just about having spent 24 hours between the emergency room and the fourth floor or third floor of the hospital. When the bill came in, the bill was $25,000. And they didn't have the charges for the doctors on that bill. That was the hospital bill. So even though we had insurance, I was almost offended by that kind of charge and that was the standard operating procedure. So I pursued it, and I like pursuing things like that and getting down to the bottom line, but the bottom line wasn't going to serve us in this case. The bottom line was that there was some contract somewhere, possibly between our insurance company and the hospital, that the entire time that we were in the hospital, we were charged the emergency room rates, even though we thought we were now patients in the hospital. And I did pursue this charge to see if there was any kind of remedy or what the basis was for that kind of charge. And the basis happened to be something in a contract that we would have no idea about. Perhaps our insurance company did. And that was that they had the right to charge us the emergency room rates for the first 24 hours we were in the hospital if we were admitted to the hospital from the emergency room. So because of a piece of paper and a clause, which there are many of those, that charge for $25,000 was perfectly fine and totally reasonable. Well, we did have insurance, as I said, so we didn't have to go to the poorhouse over that bill. But it's just not right. And this is one of many, many, many stories of our fellow New Mexicans who don't go for care, who go for care and can't afford the care, who live in rural areas where the hospitals are being threatened as far as being able to stay open because of the difficulties of the system that we're in. The Health Security Act for New Mexico would improve on every one of those things. There would be coverage for all New Mexicans. There would be choice of provider. The actual overall cost to be run according to the health security plan is a great savings to the state of New Mexico over what it is projected to be if we stay just the way we are. And so our story is just a little one, but it's a very expensive one. So thank you for listening to my story, and please look into the Health Security Act for New Mexicans.
Kathy's story. Kathy and her husband's small business struggled to provide healthcare coverage for their employees. Admirable given the unaffordability of coverage in the current system. In a recent survey, employers warned we must hold down costs because the strategy of shifting costs to employees through higher deductibles and coinsurance has hit the limits of affordability. Even the portion paid by employers comes out of an employee's compensation. Employer contributions for coverage under the Health Security Plan for large and small companies alike will be based on the number of employees and payroll, with caps. Employers will pay lower premiums for the healthcare portion of workmen's compensation insurance and lower premiums for the healthcare portion of commercial automobile insurance. $25,000 for 24 hours of hospital care. The U.S. healthcare system is out of control. Rising prices and lack of transparency are unsustainable. Slowing the health care costs will be impossible without reforms to the largest component of healthcare expenditures, hospital-based care. Hospital prices grew 42%, while physician prices grew 18% in the same period of time. Hospital administrative costs per capita, US $933 versus Canada $196. The Health Security Plan Citizens Commission will negotiate operating budgets for hospitals and healthcare facilities. Budgets will be based on a facility's spending over the prior 12-month period and long overlooked community needs that have been forfeited in lieu of profit-motivated care decisions. The Health Security Plan will set prices at reasonable levels based on the Consumer Price Index for medical care. The New Mexico Health Security Act ensures comprehensive, quality health care coverage for New Mexicans, regardless of income, health status, or employment, choice of providers and hospitals. Coverage extends across state lines, and no network restrictions. How can you help? Become informed. Check out our website on www.newmexicohealthsecurity.org. Contact your New Mexico state representatives with the following link. Tell them to vote for the New Mexico Health Security Act. Spread the word. Forward this to your New Mexico family, friends, colleagues, and neighbors. Tell your own healthcare story at www.nmhealthstories.org. Thank you.